All right, so Republicans are continuing their efforts in the war on drugs, this time by absolutely shitting and pissing their pants in response to a very mild but somewhat good policy proposal that the Joe Biden administration was unveiling to try to start the process of tackling the absolutely insane amount of overdose deaths that we have been seeing here in the United States. So I wanted to get into the details of this story with you guys and exactly what the policy proposal is, because honestly, in my view, this policy doesn't even go far enough, and yet Republicans are still freaking out over this as if Joe Biden is trying to go around to your, nice little suburban white neighborhoods and distribute crack pipes to your children or something like that. So let's just go ahead and jump into this. They say here from Salon, is Joe Biden handing out crack pipes despite right-wing Twitter frenzy? Not really. And they say Republicans on Twitter seem to think harm reduction equates free crack pipes for all. Not entirely true. So again, there's a reason here why Republicans have chosen to focus on crack pipes, even though crack pipes themselves were not even like a part of this policy at all. And the reason for that is obviously driven by racial motivations, okay? The Republican Party, rampantly racist. That isn't to excuse the racism of the Democratic Party, especially somebody like this motherfucker right here who has an extensive history in perpetuating some of the criminalization of drugs that have led to the crisis that we have right now. But there's definitely a racial component to them choosing to focus in on, Biden distributing crack pipes instead of focusing on, things that have affected more disproportionately white people, like the opioid crisis, which is really more predominantly what this policy is actually trying to focus in on. So let's just go ahead and get into some of the details here. They say, on Tuesday, right-wing politicians and pundits suddenly began to amplify the entirely spurious claim that President Biden is using federal funds to distribute crack pipes to advance racial equity. And they say, quote, the Biden administration will soon fund the distribution of crack pipes to drug addicts in underserved communities for the purpose of advancing racial equity, reported the Washington Free Beacon, a right-wing site. And they say, quote, last week, Biden talked about being tough on crime, said Tom Cotton from Arkansas. And he says, this week, the Biden administration announced funds for crack pipe distribution to advance racial equity. And here from Marsha Blackburn, she said, end government-funded crack pipes. Okay, so the problem here is that it has nothing to do with crack pipes, okay? The Biden administration is not distributing crack pipes to anybody, but again, they're choosing to focus on that because that's the type of rhetoric that has been historically, throughout the course of the war on drugs, been deployed against black communities to try to criminalize certain drugs while, refusing to act in the same over-policing and over-criminalizing way towards drugs that are more predominantly used or have been used by white communities, okay? So again, there's definitely a heavy racial component to the type of rhetoric that Republicans have been choosing to focus in on in this entire situation. But what is actually, happening with this policy? What is it actually seeking to do? Well, they say, here's what the reality tells us. On Tuesday, the Department of Health and Human Services released details of a harm reduction grant program that will allocate $30 million to nonprofit groups nationwide as part of a plan to reduce drug-related harm, particularly in underserved communities. And this initiative would expand facilities colloquially known as overdose prevention centers, which offer fentanyl test kits, safe syringe exchanges, and opioid reversal drugs for people struggling with substance abuse and addiction, an epidemic that took the lives of more than 100,000 Americans between just May of 2020 and April of 2021. So again, the things that they're actually putting in this, grant fund basically that they're putting forward is fentanyl test kits, which fentanyl has been one of the driving forces of many of these overdose deaths, obviously an extremely potent a drug that sometimes gets laced in with other opioids specifically, but many other drugs as well. And so having those test kits freely available to people or more widely available to people, that's just straight up going to save lives along with these other things. They say, safe syringe exchanges, so you're less likely to spread diseases amongst people who may otherwise be sharing syringes with each other. And opioid reversal drugs, again, the opioid crisis, which is something that Republicans pretend to care about when they, go after Purdue Pharma, rightly so. Okay, everybody should be shitting all over Purdue Pharma. They're a criminal, family that has largely created the opioid crisis. But Republicans pretend to go after a lot of these companies or these corporations that have been, destroying communities all across the United States. But then when it comes to an actual policy that is being proposed that would verifiably save lives of people who are addicted to opioids, then Republicans turn around and call it like crack pipe distribution distribution. Again, just completely absurd and not founded in reality. But they continue giving us a perspective in terms of how effective these programs have been, saying that these kinds of centers have proven exceptionally effective in reducing drug-related harm and have operated in Canada, Australia, and many European nations for years, and they're becoming more common in large American cities as well. And last year in New York, such sites successfully averted 59 overdoses within a period of just 3 weeks. Okay, 59 in just New York in 3 weeks. Okay, so again, we're talking about across the entirety of the United States, saving thousands and thousands of people from overdose deaths. Okay, it is a verifiably good policy. It is something that, if anything, again, should be much more of a larger scale than what the Biden administration is proposing here with just, $30 million or so. Okay, we need a much larger investment than that. And honestly, you don't even need to fund it. Why? Because you should be going after the criminal Sackler family and other, pharmaceutical companies who have profited from the opioid crisis. Take their goddamn billions and use it to fund shit like this. Okay, it's a good policy. We need much more investment in things like this. Okay, it's absolutely great that the Biden administration is pushing forward with this. But they say, so here's where the part where we get to crack pipes. They say, as one of the 20 harm reduction activities in Biden's plan, HHS would provide safe smoking kits, which might include rubber mouthpieces for glass pipes to prevent injuries, as the fact-check site Snopes has noted. And they say it's this relatively minor provision within a much larger program that provoked conservatives into spinning Biden's entire plan as a massive crack pipe giveaway. To be even clearer, no actual crack pipes will be given away, and the rubber mouthpieces are one small piece of a plan intended to save lives and reduce the public health consequences of drug addiction. So again, they're not actually handing out crack pipes themselves, which if they were, who the fuck cares? I mean, that's not the point. The point is you're trying to give people access to these, much more safer drug paraphernalia so that they can use that instead of using shit that might have, like broken-ended tips, which is exactly what they're trying to address here with the rubber tips that you could put on the end of something like that. The whole point isn't to enable or encourage people to go smoke crack, okay, or to try to get more people addicted to crack. The entire point of that is to stop the spread of diseases amongst many people who are using these drugs, and also to give people that avenue to try to have an off-ramp essentially to safely use these drugs at many sites around the country that we should be building and deploying, to give people the ability to safely inject or safely use these drugs in whatever capacity they need to, so that you can actually start the rehabilitation process. Okay, that's the whole point of what all of this is. But again, there's a heavy racial component here of conservatives choosing to focus in on this one tiny component within this larger plan that Biden is putting together, and they don't call out the things that would go and help people who are suffering from opioid addiction. They just focus in on crack pipes, even though crack pipes are not even a part of this plan. And again, that's because they understand the racial overtones and rhetoric that has been used historically for the crack epidemic that was instituted in many black communities during the war on drugs. Okay, again, largely led by the United States government themselves. But that's the racial component that Republicans are, of course, inserting into this entire conversation. But it's just, again, not founded in reality. This is an objectively good policy. And just to give you a little bit more perspective in terms of an actual example of how this is played out, or this type of decriminalizing drug use and implementing things like this, what it has resulted in. A great country that is basically, damn near eliminated their overdose crisis that they had is Portugal. So let's just go ahead and check in with what Portugal did. So they say here from Statista, during the 1990s, Portugal was devastated by a drug crisis where 1 in every 100 people became addicted to heroin, and the rate of HIV infection soared to become the highest in the European Union. And Portugal's radical move to put an end to the carnage should prove an example to other countries dealing with similar problems, especially the United States, where opioids have killed more people than the totality of American military casualties in Vietnam, both Iraq wars, and Afghanistan combined. And that move was decriminalizing the consumption of all drugs, and Portugal became the first country to do it. So obviously Joe Biden isn't doing that, right? He's not decriminalizing all drugs or anything like that, but he is taking a mild step in the right direction. But just to give you a perspective in terms of how wildly successful decriminalizing all drugs was for Portugal, they say, then and now Portugal's drug decriminalization, key developments since Portugal decriminalized in 2001, overdose deaths in 1999 went from 369 29 to just, barely a couple decades later down to 30. And then HIV diagnosis due to injecting went from 907 down to 18. And number of people incarcerated for drug offenses went from 3,800 down to 1,100. So again, these are the types of effects that you could expect if we further on this trajectory of decriminalizing all drugs and treating drug addiction instead of as like a crime, because it's not going to get anybody anywhere. You don't, stop this entire cycle from happening if you just throw people in jail. And that's basically what our policy has been for decades now, largely thanks to, again, this motherfucker right here. But I mean, this policy of the war on drugs, of criminalizing drug use, it doesn't work, okay? That's why there's that famous phrase that people are always saying right now that, I'd like to congratulate drugs on winning the war on drugs. Yeah, because you cannot get rid of this, okay? This is something that is baked within society. If you criminalize it, then you're only going to make it more difficult for people to seek rehabilitation. You're only going to perpetuate the cycle of throwing people in prisons and then they get out and they can't find access to stable jobs or stable housing, and then they go straight back to drug use. You're not going to actually solve the problem at all if you are focusing on the criminalization of drugs, okay? So this is a right move in the right direction for the Biden administration, but again, it's not going nearly far enough, especially given the history of who Joe Biden is and what he specifically has done to perpetuate this crisis in the first place. So just to give you a little bit of a historical perspective and who Joe Biden was in the 1980s and 90s during the run-up to the war on drugs, here from Vox, they say Joe Biden's long record supporting the war on drugs and mass incarceration. So just to give you one quote here, he says, consider one moment in Biden's career. In 1989, at the height of the punitive anti-drug and mass incarceration policies, Biden, who was then a senator, went on national television to criticize a plan from George H.W. Bush to escalate the war on drugs. And the plan, Biden said, didn't go far enough. Okay, so he was literally to the right of George H.W. Bush, okay, on drug criminalization. And he said, quote, quite frankly, the president's plan is not tough enough, bold enough, or imaginative enough to meet the crisis at hand. He called for not just harsher punishments for drug dealers, but to hold every drug user accountable. And Bush's plan, Biden added, doesn't include enough police officers to catch the violent thugs, not enough prosecutors to convict them, and not enough judges to sentence them, and not enough prison cells to put them away for a long time. A direct call for more incarceration. And as the head of the Senate Judiciary Committee in the late 80s and early 90s, Biden did not just support the war on drugs and mass incarceration. He wrote many of the laws that helped build a punitive criminal justice system, and that included measures that enacted more incarceration, more prisons, and tougher prison sentences for drug offenses, particularly crack cocaine. Okay, so again, we circle all the way back to, a man who has a very, horrible track record in terms of these same policies and these ideas in the first place, okay? It's not something new. This is the case with many other problems that we're facing right now. Joe Biden, along with many Republicans, helped to institute a lot of these crises, okay? So again, at the end of the day, his plan doesn't go nearly far enough, in my opinion, okay? We should be pushing to do more similar actions to what, like, Portugal did, for example. We should be pushing to decriminalize all drugs and actually treat addiction like it's a health issue, okay? Treat addiction like it's a public health issue instead of like it's a crime issue, okay? Nobody is going out there and getting addicted to these horrible drugs because they're some inherently horrible person. It's because of, things like their economic insecurities or, again, like mental health related things or whatever just fucked up situation they may have in their own personal life. So Joe Biden should know something about that himself. Obviously, his son, Hunter Biden, was a drug addict himself. So, have a little bit of empathy here. And, it's good that he's implementing this policy. I hope that they don't back down to the right-wing mobs. But, at the end of the day, it's a good policy. And if anything, it should be much larger and at a much greater scale, because that's what the opioid crisis and more generally the ongoing war on drugs is going to require. We got to wind down the war on drugs. It's a completely failed effort that has led to nothing but more suffering, more addiction, more incarceration. So, end the war on drugs, decriminalize all of these drugs, and start the process of solving this absolutely massive crisis.